Hello, everybody. This is Dr. Natalie Magda. I'm joined today with Dr. Kyle Swanson, and today we'll be talking about plantar fasciitis. Before we begin, I'd just like to thank KSB Community Wellness for having us so we can talk about this condition that affects many of our patients. And we see many patients throughout the day who have this condition that can be very debilitating and very painful. So we'll dive right in. So plantar fasciitis, we'll talk about what is plantar fasciitis, different causes, treatments, prevention, and when to seek medical advice for this condition. So to understand plantar fasciitis, you have to understand what is the plantar fascia ligament. So this is a ligament that goes from the bottom of your heel and extends up to your toes. This goes throughout the entire bottom of your foot and helps support your foot. There are three bands to the plantar fascia: the medial, central, and lateral band. Oftentimes, patients will have pain in the mid-arch, which is the mid-substance area of the plantar fascia that can get irritated. Oftentimes, patients will have pain. This can happen with the first couple steps in the morning. Also, patients can feel pain after standing after prolonged sitting. This pain may or may not improve with activity. Again, we see many people with this pain, and we estimate that about 10% of the population experience some form of plantar fasciitis. This pain typically tends to be localized at the bottom of the heel. Oftentimes, this pain is felt throughout the arch, and then patients can also develop pain on the outside of the foot. This can be due to compensation because you start walking differently when you expect pain in one portion of your foot. So what are some different causes of plantar fasciitis? So oftentimes this is an overuse injury. Many patients who have plantar fasciitis are patients that are on their feet all day, maybe healthcare workers. It can also occur due to trauma. There oftentimes is an underlying biomechanical source or the structure of our foot and how we walk that could be contributing to plantar fasciitis. Sometimes plantar fasciitis can develop with change in shoes or activity, especially in times where you're wearing less supportive shoes. Oftentimes, you'll hear patients speak about a bone spur. So plantar fasciitis can cause a bone spur, and patients will experience pain in the heel. With this chronic repetitive pain, and tiny micro tears will occur in the plantar fascia. These micro tears bleed, and the body tries to heal them, but this is an ongoing process, and with every step in the morning, continued steps, this process of inflammation continues. This, over time, causes trauma to the bone and can form a bone spur. So it's not the bone spur that's causing plantar fasciitis, but it's the plantar fasciitis that will cause a bone spur. Thank you, and I'll turn you folks over now to Dr. Kyle Swanson.
Thank you, Dr. Magda. So now we will get into the treatments of plantar fasciitis. And so you can see that first point there I underlined because stretching is the absolute most important thing that we can do to get rid of plantar fasciitis. A lot of this is stemming from tightness in the back of our leg and the calf muscle and the Achilles tendon, because that is the most deforming force of the entire foot and ankle when we have tightness. And so we recommend stretching even 3 to 5 times a day. If we need assistance with that, we are very fortunate here at KSB to have an outstanding physical therapy department where they have various modalities to help patients through their progression and treatment of plantar fasciitis as well. Supportive shoes is always important. There's a 3-point shoe test that we often educate patients on. When you bend the shoe from the toe and the heel, it should only bend where the toes bend. And then you should not be able to wring the shoe out like a wash rag. It should be nice and solid. And then in the back, if you squeeze the heel, it should not collapse down. And if it does not do this, that means that the shoe is supportive. Other treatments. So we can add in an orthotic or an insert into the shoe for additional support. These can be over the counter or OTC versus a custom insert, which is specifically made to the patient's foot. RICE therapy, rest, ice, compression, elevation, and anti-inflammatory use can be helpful. And then also steroid injections. with steroid injections, there is a numbing agent and a steroid, and the goal is to decrease that inflammation, and then that will decrease the pain. Hopefully, it only takes one steroid injection, but sometimes we do need to repeat this process. If all conservative treatment fails, which is about 10% of the time, then we need to move to surgical treatment options. And the most common is partial release of the plantar fascia. So this slide I wanted to add in because this shows how an orthotic or an insert can help balance our overall body alignment. That imbalanced or left image there, you can see that the left foot, the arch has dropped in. That's going to cause more stress to the bottom of the foot and that heel, which can create the plantar fasciitis process. Pronation is one of the most deforming forces also that stresses the bottom of the foot out. An orthotic is going to work against that and prevent this pronation, and that improves pain and overall function for our patients. So now prevention. Well, a lot of the prevention are the things that we talked about regarding treatment. Once we get to this stage of prevention, we go into what's called maintenance mode and do the things that helped us get over plantar fasciitis to help prevent it from coming back. So that involves wearing continued supportive shoe wear, orthotics, those daily stretching exercises that we mentioned, stretching anywhere between 3 to 5 times a day, and even before you get out of bed. It can be as simple as doing some gas pedal exercises, moving the ankle up and down and in circles, just enough to get that foot and that ligament and all the structures really in the foot and ankle moving before you step down on your feet and start your day. And rice therapy is always important as well. So in conclusion, plantar fasciitis is a very common condition that we see on a daily basis. And after that heel pain subsides and we can figure out what we need to do to help you get over this heel pain, we go into maintenance mode for prevention. So we ask, when do you need to seek medical advice? If you have prolonged pain that you just can't get rid of after trying some of these conservative, simple modalities, we are more than happy to see you. And then the other one is if you cannot bear weight to the foot, because it could be plantar fasciitis, but there are a lot of other heel conditions that could be going on. And so early treatment, early diagnosis can help us to get you over this condition that much faster as well. So that concludes our presentation this evening. We'd like to thank you again for joining us. Thanks again to KSB Community Wellness and Aaron Fox. If anybody has any questions, feel free to leave them below and we'd be happy to get back to you. And if anybody's experiencing heel pain, we'd be more than happy to see you, evaluate you, and help you get over your heel pain. So we hope everybody has a safe and fun fall season, and we'll see you soon. Thank you. Bye-bye.